Hi, my name is Ranjeshni, and today I will be performing a neurovascular assessment skills video on my patient. And to begin with the video, I'm having my badge on, and I do not have any jewelries or any nail polish on my fingers, and I'm having my dress code appropriately. To begin, I will go ahead and introduce myself to the patient and as well as do my two patient identifier. Hi, my name is Ranjeshni and I will be your nurse today. Can you please go ahead and verify me your first and last name?
Rishabkar,
And your date of birth?
April 1, 1992.
Thank you. So today I will be performing a neurovascular assessment on you, and this assessment helps to evaluate the function and the integrity of your nervous system. While most tests would typically be done to perform bilaterally in a critical settings, but we will go ahead and do this demonstration um, just unilaterally. Is that okay for you?
Yes.
Okay, perfect. So we will go ahead and do a neurovascular assessment on you, and that the first assessment will be done as a sensory response to a superficial touch and pain. Is it okay if I go ahead and proceed?
Yes.
Okay, so first I will go ahead and assess you for a sensory response to your superficial touch and pain, and I will have my cotton wool and as well as a tongue blade with me, which I will be using to touch a different areas on your skin. So please go ahead and close your eyes, and when I touch you, indicate whether you feel it and whether it is a touch, sharp or dull sensation. Okay?
Touch. Dull. Sure.
Perfect. So my second assessment on you will be for a perception of position. So please place your hands on your knees. Perfect. A little bit more closer to your knees. Perfect. And it has to be a little bit straighter. Perfect. And then with your fingers extended, close your eyes, and I will move your fingers on each hand and as well as on your toes. It will go up or down, and you need to tell me the direction if I'm putting up or down, okay?
Okay. Down. Up. Down. Up.
Good. So my next assessment on you will be for a object identifier. So I will go ahead and place a object, and you need to feel the object in your hand and then tell me if you are able to know what kind of object I put in your hand. Is that okay? Okay. So close your eyes and then go ahead and feel the object and tell me what it is.
Coin.
Okay, thank you. Okay, so now my next assessment on you will be for the point 2-point discrimination. So for that, I will go ahead and touch your arm with a 2-point open perception, and so you need to let me know if you feel 1 or 2 points, okay? And then as I move them closer, you need to let me know if you feel 1 point or if you feel 2 point, and for that you need to close your eyes.
2, 2, 1.
Perfect. Okay, So for my next assessment on you, it's going to be a number. You need to show your hand like this in the camera, and then I'm going to go ahead and use my finger to draw a number on your hand, and you need to identify the number and tell me. Is that okay?
Okay.
Perfect. Go ahead and close your eyes.
3.
Perfect. You can go ahead and put your hand down. Okay. So now my next assessment is going to be a point. Is going to be a point localization, and then for that I will be touching different areas of your skin, and then please close your eyes for that, and then point to the location wherever you feel the touch when I'm going to touch you. Okay.
Okay.
Perfect. Okay, so now my next assessment on you is going to be a deep tendon reflex, and then my first assessment will be on your bicep reflex. So please relax your arms with your palm up like this. Perfect. And then I'm going to be using I'm going to be using this a hammer to do my assessment, and then I'm going to place my thumb on the bicep tendon, and then I'm going to be tapping with a pointed end to the to feel the reflex. Perfect. And then my next assessment is going to be for the patellar reflex. I will go ahead and locate the tendon just below, move your hand, just below the kneecap, and then I'm going to tap, and then it's going to be here. I'm going to tap it with a flat part side of the reflex hammer. Perfect. So now my next assessment is going to be for the patellar reflex, and for that I will for that please lift up your foot toward the camera. Perfect. And then for this I'm going to be using the opposite side of the hammer, and I'm going to stroke the lateral side of your foot, and then across towards your ball. So for the normal response, it's going to be downward movement to the movement to the toes, and then for the abnormal response, it's going to be upwards flirting to the toes, which will be like this or either upwards. Okay, go ahead and do one more time. Perfect. Okay, relax your leg. Okay, so for my next assessment, it's going to be for your ankle clonus, and then I will dorsiflex your foot and then release it. If you feel if your foot relaxes smoothly, that is going to prove as a normal response, and if your foot jacks or shakes, that would indicate that it's a abnormal response, and that's going to be like this. Perfect. And then for the jack, if it's abnormal response, then it's going to jack like this. Go ahead. Okay. So relax. Perfect. And then okay, good. So now my next assessment on you. It's going to be for the coordination and fine motor skills. And then for that, I will be placing your, you need to place your heel on your opposite side of your knee, and then you need to, what you need to do, you need to slide it towards your shin, and you have to do that bilaterally. That means you have to do it both sides. So left side, do it on your right side, perfect, and then right side, do it on your left side. Nice. So my next assessment is going to be, I'm going to be assessing your coordination, and then please extend your arms and then touch your nose, attending hands while closing your eyes. So that means you have to do like this, and you have to do, close your eyes. Okay, go ahead and do it faster. Perfect. So now please hop off the table and come on the floor. Good. And then what I want you to do is I want you to run in place for a few seconds. So that means just keep doing like this. Okay, perfect. Nice. Stand a little bit back. Okay, perfect. So now my next assessment on the patient will be for the Romback test, and for this final test I will be assessing your balance using the Romback test. So what I'm going to be basically doing is that you have to stand as you are right now on your feet, together with your arms on your sides. So go ahead and put your arms on your sides, and make sure that your eyes are closed, and remain still for 20 seconds. I will and close your eyes as well. So I will be standing next to my patient for the safety, and but I'm not going to be touching my patient unless and until it is needed. So go ahead and make sure your legs are closed, and then side. Okay. And I have my watch next to me, and I'm going to monitor the time. Perfect. You can go ahead and open your eyes. And then my last assessment on my patient, I'm going to be going to do the gait assessment to make sure that patient's rhythm and his hang swing, and as well as his posture is correct. So I want you to walk a little bit, few steps forward, closer to the camera, and then return back. Okay, perfect. You can go ahead and sit down. So that concludes my assessment on my patient for the neurological assessment. Thank you for your coordination, and I will be going to go ahead and do the documentation for your findings. And I'm also going to be doing the documentation for the measurement of the 2-point discrimination which I did on the patient. So before I go out of the room, I want to make sure that my patient is in the comfortable sitting, and I also want to make sure that patient has the safety around him. And I will go ahead and wash my hands and do the documentation, and then close the room, and I will go ahead and come out of the room after doing my hand hygiene. Thank you, and that concludes my neurological assessment video.